Hello and welcome to Awaz News. I'm Kubrali and I'll be taking you through big news across Canada. Ontario to expand COVID-19 booster eligibility to children aged 5 to 11 Thursday. Ford government passes bill that allows hospitals to move some patients to nursing homes. Ford says Trudeau agrees status quo isn't working amid healthcare crisis. Toronto University student who died in skydiving accident remembered as one of the bravest people. Canada to implement 988 suicide crisis line starting fall 2023. Toxic chemicals commonly found in dollar store items, testing shows. Ontario scraps mandatory 5-day isolation rules for people with COVID-19. Those were the headlines, and let's jump right into the details. Ontario is expanding COVID-19 booster shot eligibility to children aged 5 and up starting on Thursday ahead of students returning back to school next week. Ontario's Chief Medical Officer of Health, Dr. Kieran Moore, announced on Wednesday that booster appointments will be opened for children between 5 and 11 years old as of 8 a.m. on September 1st. We encourage parents to make arrangements to get this booster for your kids in this age group, especially those children with underlying medical conditions that may place them at a high risk, Moore said during a news conference. Eligible children can receive their third dose, also known as first booster shot, at a recommended interval of at least 6 months following their most recent dose. Parents and caregivers can book the appointments through COVID-19 vaccination portal or by calling the Provincial Vaccine Contact Center at 1-833-943-3900. A second booster shot is currently available for youth aged 12 to 17 and can be administered at an interval of 6 months since their booster. As of late July, children under 5 years old were able to receive their first vaccine dose after Health Canada approved Moderna's COVID-19 vaccine for infants and preschoolers. As of older residents, the Ontario government expanded fourth dose eligibility to all adults in July as well. Individuals aged 18 and over are eligible for their second booster dose at a recommended interval of 5 months since their first booster dose. Ontario's progressive Conservative government passed legislation Thursday that would force hospital patients awaiting long-term care into nursing homes not of their choosing on a temporary basis, but many details of the new law remain unknown. Patients who refuse to move to long-term care are expected to be charged a fee, although it's unclear how much. Premier Doug Ford has said, however, that they won't be billed an uninsured rate of $1,800 per day. Ford said the legislation is aimed at providing appropriate care to those patients. It's not about the cost, it's about giving proper health care to people that should be in long-term care, Ford said in question period Thursday. NDP leader Peter Dutton said the new law will hurt seniors and cause needless suffering. It's very clear people will get bullied, they will get huge bills, they will be pushed out of the door. He said neither long-term care minister Paul Calandra nor health minister Sylvia Jones spoke to reporters following the passage of the bill. Early in the day, Calandra scoffed at the idea hospitals could charge exorbitant amounts to patients who refuse to move into a nursing home not of their choosing. The province pushed through Bill 7 quickly as part of its effort to deal with an ongoing health crisis, moving early this week to bypass public hearings on the legislation. Hospital emergency departments have been closed for hours or days at a time in recent months, largely due to nursing shortage. Ontario Premier Doug Ford says he and Prime Minister Justin Trudeau agree the status quo cannot continue when it comes to healthcare and said delivering it differently must be part of the solution after the two met at Queen's Park Tuesday. Speaking with reporters following the meeting, Ford said that Trudeau knows what he and the other premiers are looking for when it comes to their previous ask that the federal government provide a greater share of the funding of health care. He said he had a great meeting with Trudeau and is very confident that they will come to a deal. We know how urgent this is and we're gonna make sure that we sit down and really work out a deal, Ford said. The premiers have said that the federal government provides around 23% of healthcare funding, though the federal government has disputed that figure and said that it is closer to 35%. Ford government has been under fire this summer for lengthy hospital wait times amid a province-wide shortage of healthcare workers Ford acknowledged Tuesday that people should not have to wait 10 to 12 hours or more to be seen by a doctor. Ford said he and Trudeau agreed that, whatever the funding arrangements, healthcare needs to be delivered differently. Speaking with reporters, Ford defended his government's plan to make it possible for hospitals to transfer some patients waiting for long-term care to nursing homes not of their choosing, a plan that has faced questions and caused alarm among some observers. Said he and Trudeau also touched on 3 other main topics in their meeting: housing, immigration, and infrastructure. A 21-year-old Toronto University student and TikTok influencer who died after opening her parachute too late while skydiving is being remembered by friends as one of the bravest girls. According to friends, Tanya Pardesi died on Saturday while completing her first solo dive with Skydive Toronto in Innisfil, Ontario. The company said in a statement, Sunday, the student released a quickly rotating main parachute at a low altitude without the time or altitude required for the reserve parachute to inflate. She was transported to hospital where she was pronounced dead. Pardesi was studying philosophy at the University of Toronto and ran a successful TikTok account with nearly 100,000 followers, friends said. She also participated in previous Miss Canada competition and made it to the semi-finals, her friends said. Tanya had an interest in anything that was new and adventurous. Her childhood friend Melody Osgoli told CTV News Toronto on Wednesday, "Life was too boring for her and she was always trying to do something adventurous." Osgoli said Pardesi was completing her solo course at the skydiving school and this was her first time jumping alone. She really lived every second to the fullest, Osgoli said. This is the biggest shock to us. It's very hard to process. It's been a couple of days, but we still don't even believe it. The CRTC says it will launch a new emergency crisis number for people in need of immediate mental health or suicide prevention support. It says starting at the end of November 2023, Canadians will be able to call 988 to be connected to a mental health crisis or suicide prevention service free of charge. The Public Health Agency of Canada will decide which group will provide the service along with the scope of care it will offer. The move will bring Canada in line with the United States, which launched its 988 service last month. But the CRTC says it must first transition to 10-digit local dialing across the country. As it stands, 7-digit local dialing is still the norm in Newfoundland and Labrador, Northern Ontario, and the Yellowknife area. The CRTC has given a deadline of May 31, 2023 for service providers to implement 10-digit dialing across the country. Meantime, the CRTC notes that people in mental health distress can call Talk Suicide Canada at 1-833-456-4566. A Canadian environmental organization is calling for more transparency and better enforcement of national regulations of toxic chemicals after more than 1/4 of items bought at a popular dollar stores tested positive for substances such as lead. The Environmental Defense Report is based on the analysis of a dozen of products, including electronics, toys, canned food, and microwave popcorn. The chief concerns is that the Canadian Environmental Protection Act currently only limits the level of toxic substances in what is considered the outwardly accessible part of the product. The solder inside some earbuds and toys tested positive for the lead levels 8,000 times above the maximum amount that is allowed on the outside of the items. Environmental Minister Stephen Guilbeault says he will read the report and is open to making changes to the act, which is already in the midst of a legislative update that will be debated in the House of Commons this fall.
Thank you for tuning in. I'm Kubra Ali. I'll see you back tomorrow, same time, same channel. Have a good night.